I'm back. Took you long enough. So, what are we talking about today?
Well, what's your big question today, kiddo?
Statins! I've been thinking about what you said last time, lowering cholesterol. And I saw one of the side effects starts with an A. What is it again?
Dementia, including Alzheimer's. And you're welcome.
Yes, that's it. Come on, Jason, give us the scoop.
You really love these, don't you? All right, let's dive in. So, here's the deal. Our brains are made up of about 60% fat, and the brain has 20% of the body's cholesterol. A study from the McGill Group for Suicide Studies at Douglas Hospital found that because cholesterol is crucial for brain function, if you lower it too much, like with statins, it can speed up neurodegeneration, meaning damage to your brain, and lead to dementia or diseases like ALS.
ALS. You mean amyotrophic lateral sclerosis? Like the one that you slowly can't move your body well.
Yes, that one. Think of cholesterol as the building blocks for your neurons. If you take that away, your neurons start to break down faster, and new ones can't form as easily. Statins, which are supposed to lower cholesterol in your body, might also be messing with your brain. This is the key! One of the studies, the Serum Cholesterol and Cognitive Functions, Lothian Birth Cohort, 1936, found that people with lower cholesterol levels had lower cognitive abilities. And not just any abilities, I'm talking memory and processing speed. So, higher cholesterol seems to be linked with a sharper mind. And get this, another study found that people with mild cognitive impairment who were taking statins had more than double the risk of developing dementia compared to non-users over an 8-year period. At age 70, people with higher cholesterol had a 23% reduced risk of Alzheimer's. At age 75, that dropped even further, to 30%. So, while statins lower cholesterol, they might also increase the risk of memory issues.
Oh Lord, this is so freaky.
But wait, there's more. Statin users had a whopping 440% increased risk of acute memory impairment within the first 30 days of use. Yeah, that's a big deal. And not just for statins, non-statin LDL-lowering drugs showed similar memory issues.
Wow, that's insane. I had no idea statins could mess with your brain like that. And all this time, I thought they were just, cholesterol busters.
They are, but they come with side effects people need to know about. It's not just about cholesterol. When you're messing with something as vital as brain cholesterol, you've got to be careful. And that's why it's so important to talk to your doctor. They need to weigh the benefits and risks for each individual person, so always consult your healthcare provider before making any changes.
Sure I will. I'm learning a lot from you, Jason. Who knew you were so full of wisdom?
Just doing my job. Well, that's all from me, and I guess it's time for us to say,
oh, goodbye. Thank you. Hey, I'm back.
No customers but you again?
You missed me too. Everyone does. So, what's today's topic?
You haven't even thought about that yet? You…
Stop. You're making me depressed.
Depressed? Perfect. Here's today's topic: statins and depression. Statins are medications designed to lower cholesterol. But did you know they can also affect your mental health?
That's shocking. Not only physical symptoms, but also mental?
Statins can impair the function of serotonin receptors, and when serotonin is out of balance, it can lead to depression. Research shows that people with cholesterol levels under 160 are 3 times more likely to experience depression compared to those with higher cholesterol. This is the key! A study by the University of California School of Medicine found that low cholesterol levels were associated with depressive symptoms in elderly men. It even suggested a link to increased risks of suicide. Another study by the Karolinska Institutet found that in middle-aged Swedish women, low cholesterol was linked to depression and lack of social support. This connection could explain why low cholesterol is tied to higher mortality rates due to suicide. In Mexico, research found that low cholesterol, or hypocholesterolemia, was independently associated with depression and even suicide attempts. They suggest measuring cholesterol could help predict suicide risk, an inexpensive and minimally invasive way to save lives. Dr. James Lake also said, depressed patients with elevated cholesterol aim to go no lower than a total serum cholesterol level of 160. Below that level is where risk for violent death and suicide and accidents begins to climb in many of the association studies. Some of the most common psychiatric symptoms reported with statin use include insomnia, agitation, confusion, and even hallucinations. Insomnia, in particular, stands out and is reported more frequently for statin users than with other medications.
Wow, that is a lot of symptoms. Gotta be cautious.
Because of these sleep disturbances, statin users are often prescribed medication for insomnia, which can further complicate things.
Wow, I had no idea cholesterol levels were connected to depression.
Yep, cholesterol does a lot more in our bodies than people think. So, if you're lowering it quickly with medications like statins, there's a risk. We need to be cautious.
See, this is why I keep coming here. I'm learning so much.
You've been here enough times. I think we all know when it's time to say goodbye.
Yes, see you soon.
I said, don't come back if you're not buying anything.
Bye. Hey.
I know what you're gonna say. First, I didn't miss you. And second, you want to know more about statins. Well, guess what? I've already picked the perfect topic for today. Aggression.
I guess you had a lot on your mind.
Yes, I do. You keep coming here, not buying anything distracting me, and pulling stuff from my pockets. I'm not putting up with it anymore.
Okay. I agree. Aggression is a great topic. Let's go.
You never listen at all. So, let's talk about aggression and low cholesterol. Studies show that low cholesterol isn't just about heart health. It can also mess with your brain. A study by the University of California found that low cholesterol levels were strongly linked to criminal violence. They discovered that men with low cholesterol faced a 2.8 times higher risk of dying from violent deaths, like suicides, homicides, and accidents. And get this, their risk of death by suicide jumped by over 4 times.
Wow, that's a big jump.
And it's not just about violent deaths. Other studies show that violent suicides had lower gray matter cholesterol content compared to non-violent cases. Essentially, men with low cholesterol and depression face a 7 times higher risk of suicide than the average male. This is the key! The connection here? It's all about serotonin. One popular hypothesis by Engelberg in 1992 even suggests that low cholesterol in the brain might affect serotonin receptors, leading to decreased serotonin binding and uptake, which plays a big role in impulsivity and aggression. Imagine it like this. Lower cholesterol in the brain means a less stable cell membrane, and that could mean less effective serotonin transmission. The result? More aggression and impulsivity.
Sounds like you need more cholesterol too, Jason. You're very aggressive. I guess it's time to say goodbye, right?
Farewell. Please leave.
See you!
Don't come back unless you're buying something.
Hey, how are you?
You're very persistent.
Come on, don't be too cold. I actually came to get some medicine prescribed.
You? I thought idiots don't get sick. Interesting.
What? You're so rude.
So, what do you need today?
Well, I used to take statins, but I feel so nauseous. Is that a side effect?
For that, definitely I can help. Statins are pretty common for lowering cholesterol, but they come with some baggage. Headaches, insomnia, skin flushing, muscle aches, drowsiness, dizziness, nausea or vomiting, belly cramping, bloating, diarrhea, constipation, and even a rash. So, if you can't find another reason for your nausea, it could be due to the statins.
How long does it take to recover? And what can I do to feel better?
Good question. This is the key. Recovery usually depends on how long you were taking them. It could be anywhere from 6 months to a few years. But here are some tips to help you manage it. 1. Take a break. Temporarily stopping the statin can help figure out if your pain is due to the statin or not. 2. Adjust your dose. Lower doses could mean fewer side effects, but consult your healthcare professional. 3. Try different meds. There are other cholesterol-lowering options that might work for you with fewer issues. 4. Supplements like CoQ10. There's some buzz that CoQ10 could help, but you should check with your doc first. 5. Exercise, weight loss, and thyroid checks. These are helpful no matter what.
I can't believe I got a side effect.
Don't worry, it can happen to anyone, and it will go away if you stop taking the statins for now.
Well, Jason, I didn't know you could be this polite and nice to me.
What do you mean? I'm always nice to customers, but you were never a customer before.
Okay, well, I feel a bit better. Time to say goodbye.